Welcome to the webinar, everyone. We'll get started in just another minute or two. We still have some people joining us. As soon as the folks signing on slows down just a bit, we'll get going. Okay, it looks like folks have joined in, so we'll go ahead and get started. Welcome to today's webinar. I'm Kim Brown with the Rural Institute Transition and Employment Projects, and I'll be your moderator for today. Today's webinar is sponsored by the University of Montana Rural Institute Transition and Employment Projects in partnership with Children's Special Health Services and the Developmental Disabilities Program at the Montana Department of Public Health and Human Services and Parents Let's Unite for Kids, or PLUC. All attendees are currently muted. If you want to ask any of the presenters a question, and they do welcome questions throughout their presentation, you may raise your hand or type a question into the chat box. And it is more efficient if you're able to type your question into the chat box. We're able to pull those up more easily. Sometimes we have a tough time unmuting people for questions. So it is best if you can type your question into the chat box. For those of you who requested Montana Office of Public Instruction renewal units when you registered, we will email those to you after the webinar. It generally takes a couple of weeks to get those out, and you do have to have pre-registered in order to receive the OPI credit. Please note that we are currently unable to issue other kinds of attendance documentation for the webinar. Today's session is being audio taped for the Rural Institute Transition and Employment Projects Resource Library and for the PLUC Rural Institute Online Transition Toolbox, and I'll put those two website URLs up into the chat box a little bit later during the presentation if you'd like to copy them down. After today's webinar, you will receive an email with a link to a really short survey just asking you how you found today's webinar, whether the information was helpful to you, whether the technology worked for you, and whether you have other topics that you would like to see us address in future presentations. So please do take a few minutes to go and complete that evaluation. We read all of the surveys that we get, and we do use the feedback that we receive. And with that, I'd like to go ahead and introduce today's speakers. They will each tell you a little bit more about themselves, but we're delighted today to have with us Roger Holt, Diana Tavery, Teresa Baldry, Diane Booth, and Kelly McNerlin. Thanks, and take it away.
Well, thanks, Kim. We really appreciate you putting all of this together, and thanks to all of you that have agreed to participate on the webinar today. Just a note to everybody: we're pretty informal, so you can type in, a chat in at any time. If we have fewer people, we probably would unmute everybody so we could have more of a group discussion, but with this many people, it just becomes a little bit too unwieldy. But using the technology, just feel free to speak up at any time, and we'll try. One of us is going to monitor the questions as they come through, so we'll try to keep up. And we are going to try to get all of you out there to interact a bit also using this technology. And so when that time comes, we just want you to kind of practice, using these tools so that we can all participate. And that's all my phone going off. Can't turn off the ringer. Hang on. There. Okay. Okay. So our goal, or kind of the takeaways that we came up with today that we would like, kind of all of you to be able to go away with at the end of the session today is, number one, to know where you can access this information on the website, to be able to download the information, and to be able to refer other people to it. So the main thing to remember is that the Guide to Success is at pluck.org on the Pluck website. You can go directly there to actually be able to find the link on the left-hand side to the Guide to Success. And then that will take you directly to the online information where you can actually download printable guides and be able to print them off yourself, plus be able to access all of the information online. This is just a PDF that we're showing here that is the actual guide when it's downloaded, the electronic version that is printable. So being able to find the information online and be able to refer to that information, and to be to understand that parents need information and resources to be able to make informed decisions. And our goal with this guide was to be able to, provide enough information so that a path or enough information is provided to be able to answer any kind of a question. So then the other goal is to kind of dispel some of the myths that are out there regarding services, and so that with any question that might come up, where would you go to be able to find an answer to those questions. So that's kind of our goal for today. So the first thing that we would like you to do, oh wow, Teresa, you're really cool. Teresa's posting some of the links. That's very good idea. I'm glad I'm working with such great people. Anyway, so right now what we would like you to do, all of you that are listening in, and if you're listening in with a group, we would like you to go to the chat box and just type in where you are, geographically, what city you're calling from, and state. We know some of you are out of state. What you do if you're a provider or a professional or a parent, and why you are here. Why were you interested in participating in this presentation? So just go to the chat box, type that in. Doesn't have to be long and lengthy, but it'll give us all an idea of who's online and what your questions are. So just go for it right now. We're going to watch those as they come in, and as you're doing that, what I would like to do is go around and have each of our speakers introduce themselves and tell a little bit about themselves, and I'll start. My name is Roger Holt. I'm the director of PLUCK, Parents Let's Unite for Kids. We're the Parent Training and Information Center for Montana. We provide information, training, support to parents, kids, individuals of any age, educators, professionals, anybody who needs assistance can call us to ask questions and get assistance regarding a child or an issue regarding a child or an adult or individual. And we do our best to try and direct people to the resources that exist in the communities to be able to resolve the issues. So, Teresa, you want to go next?
Sure. I was in a flurry of typing in and writing down kind of the things that are coming in. Most of those are coming in through the question box versus the chat window. The chat is located at the bottom of your control panel. It's fine that they're coming in as questions. It's just everyone would be able to see a little more if it came through chat. Not a big deal. I'll still gather the information. However you get it to us is great. So I'm Teresa Baldry. I live out in eastern Montana, so I serve this part of the state. I also work wherever I'm needed. I'm a parent of 6. I have 1 child with special needs. So that's kind of why I came to PLUCK and now work for PLUCK.
Okay, thanks, Teresa. How about Diane Booth?
Hi, I'm Diane Booth. I am a parent of twin boys. One has autism, and I live about 60 miles west of Billings here in Reed Point, and I was just kind of a part of trying to develop this guide that we're talking about.
Okay, Diane Tavery.
Hi, yes, I live in Helen, Montana. I have 3 children. I have one daughter with autism and a severe seizure disorder who is going to be turning 20 in August. That was the reason I ended up getting into advocacy work, was learning how to advocate. And actually, I think my mentor in that advocacy is actually on this program today listening in, Ms. Lisa Lowney, who is now our special ed director in our district. But I love my job and I love doing this. I thought it was great when we got this guide going up. It was certainly something that was necessary for families to understand how to navigate our difficult system. And I think that's about all I'm going to talk about right now.
Okay, yeah, we'll hear more from everybody a little bit later. And then Kelly McNerlin.
Good afternoon, everyone. This is Kelly McNerlin, and I work with the Developmental Disabilities Program for the state, and I'm at the central office here in Helena. And you'll learn more about the Developmental Disabilities Program as we go through the guide.
Okay, and you guys did very well. We got a lot of responses online. It is kind of hard to read in the question format, so that was a good point there, Teresa. But hey, you all did good. There's nothing wrong with doing that, and it looks like there are a few questions in there also. And Teresa, are you going to kind of extract some of those out?
I sure can. I sure can pull out some of. We've got. I believe we do have parents and providers on, and professionals. A lot of you I would consider in that professional realm. We have a lot of parts of the states. So we've got some people over here in eastern Montana too. Colstrip, Great Falls, Billings, Eureka, Missoula, Bozeman are all ones I've found so far. 2 of them are kind of tied together. What I pulled out as far as questions is that big question of jobs after high school and what happens. And how can we make sure that kids are connected when they leave high school so they are employed? What happens after high school? How do their services change? How do their programs change? What do we need to do to understand the DD system to make that work better for families? And then just some overall questions of understanding the DD system. So that's what I've pulled so far, Roger.
Okay, fabulous. Okay, we're doing good. So what we would like to start with is just kind of, I want to turn it over to Kelly, and any of you other guys can jump in at any time also. But I asked Kelly to join us, because she worked with us on developing the guide and was probably the closest collaborator with the Developmental Disability Services. And it was actually a very good experience, I think, for both of us to bring parents and the state agency together to try to come from the standpoint of, here's the, all the rules and regulations and the law, and how do we put that into a format that is accessible by parents and understandable, and be able to answer all of those questions that parents have that maybe they haven't been able to answer. And it turns out that they were also questions that many other people had too. So Kelly, why don't you tell us a little bit about yourself and maybe the genesis of this project?
Sure. I'm going to start with just kind of a brief history of some of the huge changes that have occurred just in administering the program over the last several years. And Roger, I appreciate what you said about there is something to be said about balancing the requirements that we get from the federal and other state levels versus those of you out in the field that are just trying to go do good things and give good services. And, there is a balance, but there are some pretty good requirements that we have to meet in order to maintain and manage the funding that we get. Over the last, let's see, I've been here for 6 years, so it probably started a couple years before me. So over the last about 8 years, the program up here at Central Office had a lot less to do with with monitoring, I guess I would say. CMS over the last 8 years have vastly increased their reporting requirements, and so therefore those things get passed down the chain.
Oh, and I'm going to jump in just for a sec, Kelly. CMS is the Center for Medicare and Medicaid, correct?
Yes, thank you, sorry.
No problem.
CMS is the federal agency where we get the bulk of our dollars from. And in order to accept those dollars, we have rules that we have to play by. And of course, those rules get passed down to those of you out in the field. So we have shifted from a system within the last 8 years who contracted with a provider, with an agency in the community, and we said, here's some money, you'll serve this many people and go do good things. And that's what everyone did. We've transitioned into a system where individuals in service have individual budgets, we have rates, we don't contract with providers for dollar amounts. So there has been a huge shift in the way that we even do business with our providers. And, you know, I don't think I need to say that it's not been easy on everybody. And we've all been learning as we've gone along in the process. So thanks to all of you out there who've been hanging in with us, because, again, we're learning as we go. And it's not been easy. It's been an uphill climb, but I think things are slowing down now. I think the expectations that now are upon us from CMS, had we not initially started moving this direction 8 years ago, we would be moving that way now, and we would be much farther behind in the process. So that's just a little bit of history. In summary, we monitor a lot more than we used to, and we don't see that going away anytime soon. So in part of how we've changed business and trying to recognize strengths and weaknesses out in the field, we definitely realize that there is kind of a gap and a disconnect with individuals and services and their families. And you know, no fault of anybody's, and we really want to try and do better at that, but you know, there's still a lot of room for improvement. Because we contract directly with our community provider agencies, we have a really good connection with providers, but again, we understand that there's this other layer of people that we really need to be connecting with. Not quite a year ago, we had a VISTA volunteer. Her name was Kayla. We did a round of community meetings around the state to gather some input on how the DD program could better connect with families and individuals and services. We got some feedback. We're still trying to develop some of those bridges, but also part of that, we knew that there was some misinterpretations, miscommunications, and that we wanted right away to try and get some information out to people, because one of the primary issues was that families and individuals, some individuals in services, they didn't even realize they were connected to our program. And so if you don't know that you're even in the Developmental Disabilities program, then how do you know where to go with questions? How do you know what to do if you're not happy with services? Where do you go if you are really happy with your services and you want to share that? So I think we worked with Roger on this project because we knew he had a great avenue to connect with families and individuals, and so together we collaboratively built this guide. And so Roger, do you want to go through some of the table of contents now?
Sure. Maybe just to start with the introduction letters. I'm going to go to that page first, and because this is probably one of my favorite parts of the guide, is that there's a letter from the DDP director, Developmental Disabilities Program Director, side by side with a letter from a parent, Diane Booth, who's on the call today, and we'll be talking about, well, you'll see. She has some very good things to say. And it was just really important for us to be able to have, well, to be able to demonstrate that relationship and where this came from, and Jeff, you know, saying how important it was to have input from families, and Diane saying, you know, we need to be able to work together because we need to learn from the providers, you know, on how the system works, and we need to be able to provide input to the system so that you know, so folks know what works, and so just to know that, you know, the powerful relationship to be able to make the system work better for everybody. And it's my favorite part of the guide, but there's a lot more parts to it, so we should probably go there. Where do you want to start, Kelly? Right at the beginning?
Sure. We'll just touch briefly on the table of contents, just with a very, very brief description about what's in those sections. And again, the complete intent of the guide is not to answer every question you might have, because that would probably be impossible. But we did want to, again, what are the most common questions? Can we get them answered in the guide? And then if you have more questions, where do you go? Who do you talk to? So I didn't even know I should have a question, but now I read this, and now I do have questions. So it was, again, Roger alluded to it at the beginning, it was intended to give out some information and either spark some questions, or at least let you know if you do have questions, here's where you can go. And in the first section, what are developmental disability services, it kind of explains a little bit about our program, our budget, and kind of why we developed the guide. And then the second section, number 2, Roger.
Yeah, it's taken its time updating.
Oh, I'm sorry.
There it is. Okay, it took it about 10, 15 seconds. So here's the first section on what is developmental disability services. And one question, you know, the parents had is like, well, what is the budget? How many people does the system serve? And so these were just key questions, you know, that most everybody had. So that's why we included those most asked questions here. And anyway, and I'm just kind of filling space so that we can see section 2 here before you actually start talking about it. And it should switch any second, but you can go ahead, Kelly.
Okay.
There it is.
There it is. What is a developmental disability? In this section, we listed the formal state definition. It's in state law. We've had feedback whether people like it or dislike it because it was established a long time ago. But we don't set the criteria. We don't set the definition. It is done through the state. So I just want to say that plug. So there's the formal definition of developmental disability. That's in Section 2. And in Section 3,
it's coming.
It's coming. In Section 3, it goes a little bit into, well, who is the Developmental Disability Program, and we are part of the Department of Health and Human Services. So that is our umbrella agency, and so we are a program within DPHHS. And as I mentioned before, several people who were getting services didn't realize that they had their fingers in state government, that we were even involved. And we don't provide all of the funding. We manage the funding and we manage the requirements of administering these programs. They don't come free. The money comes from somewhere. Most of it is from the federal government, but the federal government leaves it to the states at the state level to manage and administer those federal funds. So that is what we do from here. We make sure that reporting criteria, again, I talked about the federal funds come with following federal rules. And so we don't get the money free either. We've got a lot of stuff to do to report back to the feds on how the money is getting used appropriately for the intent. Now Roger has up on the screen, where is DDP located? Where are we? We actually have several offices throughout the state. In addition to the 6 listed here, we also have a few pilot offices. One is in Kalispell, one is in Bozeman, and one is in Butte. But these are our main regional offices. So if you are getting services or you're not getting services through our program, if you suspect you or a loved one or a friend may have a developmental disability and you want to check out where do I even go to get services, contact the regional office. In the map that is for your county of where you live. Give them a call and tell them that you have questions, and they will set you in the right direction on where to go and who to start talking to.
And this is probably one of the most important pages that we refer to throughout the guide. It's like this is one of the most important places to know, where your regional office is, so when you have a question, this is most likely, many of the questions, this is where you need to go. Go ahead, Kelly.
Okay, and the next section is what is eligibility. So as with most services, just because you think you should get some doesn't mean that you'll just automatically get it. People must be eligible. And this just briefly goes into information that we do have eligibility criteria. The criteria may be different for different ages. For example, the criteria to identify an infant or child that has DD is a little bit different than an adult because kids are learning so quickly, and also that we have our own eligibility criteria separate from other assistance programs. You can get assistance through the school, through private insurance. A lot of our individuals that get our services are also eligible for Medicaid. So we didn't want people to confuse, well, I'm not eligible for that, so I wouldn't be eligible for DDP services. That likely is not true. So if you think someone may be eligible, just because they're not eligible for other programs doesn't mean they wouldn't or couldn't be eligible for DD services.
Hey, Kelly, this is Teresa.
Yes, ma'am.
Just something that kind of came in on the boxes when people were introducing themselves and talking about this eligibility and criteria piece. Could you talk a little bit about how that may be different for autism? And is there a difference for children with autism and adults with autism?
I am not an eligibility expert. I do know, I don't know specific differences with autism and autism in particular, but what I do know is that, again, different age groups can have different criteria, and I know one of the criteria for our autism waiver is you only have to have autism spectrum disorder, and that is actually stated on page 7 of the guide. But it's a little bit, autism spectrum disorder is a little less finite than you are an adult, you have autism, and you probably won't grow out of it. So there are some, how do I say it, less restrictive guidelines for children than there are for adults. And if you have questions, again, your regional office would be the best people to contact about those questions. Or your case manager should know.
Thanks, Kelly.
Okay, so determining eligibility, again, if you think someone may or could be or you suspect, give the regional office a call, get on the wait list somehow. I mean, it's worth checking into, even though you might doubt whether or not they would be eligible. It's still worth checking out. It's assistance for you if the funding is available. So it goes through a couple of the steps, especially for families. You may have people coming in doing evaluations. You may have doctor's reports and hospital records and other school documentation that may be required. So again, you have to be comfortable with providing those and having people review those to see if your child or your family member may be eligible. It's probably not the most comfortable process, but you know, there's no way to get around it. It has to be medically determined. So,
and just a note while we're waiting for the next slide to come up, that we tried to make it as general as possible so that we weren't doing eligibility for, you know, this service, eligibility for that service. I mean, there are some differences, but this is in general, this is the process for, you know, from infant and toddlers through, you know, adult services. In general, the process is this. Am I correct?
And this is
go ahead.
And this is Teresa again. I have a question that's come in, so I'll just read it.
Perfect.
If you're an adult and looking at eligibility and SSA, already gave you a disability code of mental retardation. Would you meet the criteria, or would you need to still get documentation from a doctor to be eligible for DD services?
I can't specifically answer that question, but again, we have our own eligibility criteria. So even though SSA has that determination, we would do our own eligibility process, but it's my understanding we would probably be looking at a lot of the same information that SSA used, but we would also require it on our end.
And who would you call?
You would call your regional office.
There we go. That's one of the lessons we just want to teach. Where do you go to answer the question?
Yeah. Did that answer the question for everybody? We have a very specific eligibility process, and there are, I think, different things required depending on age and what other documentation might be available. So to really have a concrete answer is very difficult, because really it depends on that individual and what documentation they already have.
And this is another question that probably came in when we had the map up.
Okay, cool.
And sometimes things aren't flowing really well, but it says, the question is, or the comment is, I had a client who lived in Musselshell County, and she was given a case manager out of Lewistown, not Billings.
Okay. We have case managers that are both state case managers and contracted case managers. So some of our DD case managers for the adult side, I don't know if this was a child or an adult, we have both. So to manage caseloads, I don't believe we have any provider that is actually located in Musselshell County, but we have restrictions on caseload size, and in order to manage that, again, I'm not sure of the exact process that the regional offices use, but that may be part of us trying to manage caseload size. If the state agency, if the state contracted case managers or another contracted agency have too many caseloads, we have to give it to somebody else. It's in contract that caseloads are limited.
And the answer, the typed in response was yes, that it was an adult, and your answer was helpful to them.
Okay, thank you, great. Are we ready to move on to community providers?
Did you want to mention the wait list, or are you avoiding it?
Oh, yes, I'm sorry, I missed section 7. What is the wait list?
And I was going to say, sorry to interrupt again, Teresa, two of the things that came in on some of that initial information that they were looking for in regard to the wait list is the screened in information, and why do some people have cost plans and some people don't, some of that.
Okay, so let's talk about that. And we have to keep in mind that several people can be at a different step in the process at any given time. So what I'm referring to is, let's start with someone who is brand new, and either their doctor, their child care, or their parent or a friend think that they could have a developmental disability. So they, first of all, what you need to do, I'm sorry, my phone's ringing, I turned the ringer down.
That's okay, Kelly, it's not that bad.
Gosh. First of all, contact the regional office, and they will give you the steps or who to contact in order to get an eligibility determination, and you'll go through that process. Okay, so yes, the person is eligible, they meet our criteria, whatever that is, at whatever age that is. We, unfortunately, do not have all the funding needed to serve everybody that is eligible to get services. So what the wait list is if you are eligible for the DD services, you likely will not get services right away. So again, one of the reasons why it is important when you suspect someone could be eligible, get that figured out right away, because you may have a long wait ahead of you. There are like 500 to 1,000 people probably on the waiting list right now. So again, just because you are eligible doesn't mean you're going to get services right away. By services, we mean there's a menu. We've got different programs we offer, and with those programs come different menus of services that you can access. And so I'm talking in very general terms on purpose, otherwise we could overload you with details. There are two services, however, that are what we call entitled, and we'll talk about those a little bit more. One is for kids and one is for adults. And for adults, it's case management. If your family member or child or friend is 16 years of age or older, and they are determined that they meet our criteria for eligibility, they are entitled to at least case management. It's called targeted case management. That's for adults that are 16 or older. For very young kids, age 0 to I think age 3, there is a program that the young kids are entitled to, and it's called Part C, or the Infant and Toddler Program. And those are explained in a little more detail later on in the guide. So if I'm eligible for services, I probably won't get them right away, and I'm put on a wait list. To get off of the wait list, funds have to become available for a variety of reasons. We got more funding from the legislature, people moving in and out of the waiver, in and out of our services for a variety of different reasons. So again, if you are eligible, if you are on the wait list, you may not hear much for months at a time, and if you ever want more information about where am I at on the waiting list, how are things going, you can still contact your regional office and they can give you more information about how things are going with the wait list. Any questions?
We might mention that Diana's going to talk a little bit about the self-directed services once we get to her, so since she has direct experience with that. So we'll talk a little bit more about that. I'm going to go on to community providers.
Okay, can anybody hear me?
Yep.
Yeah,
Okay.
we'll go on to, do you want to do self-directed right now? Do you want to talk about it?
No, I can wait. I thought you wanted me to get on there and do that, so I can.
I don't know. It might make. I think it might make sense. What do you think, Kelly?
I would prefer to wait and talk more about what services are.
Okay. No problem. We'll wait till afterwards then.
Okay, the next section is what are community providers, and community providers are really great people, honestly, out in the field that actually do the daily supports to help people. We do have state staff, again, we've got state staff that help manage and run these programs. We have state staff that do monitoring and compliance activities. And we do have some state staff that actually do case management. But the bulk of the services directly to individuals comes from community providers. And we contract with those community providers to keep people in their own communities or communities that where their supports, where their needs can be met. So they are all over the state. Okay, any questions? Moving on. Okay, well, that's bringing, well, the next section is Montana Developmental Center. We refer to that as MDC. We have a lot of acronyms we like up here. MDC is our state-run treatment facility. I was going to use the term institution, but that's definitely what it used to be. But it's meant to serve people who are a danger to themselves or other, and the community placement or remaining in the community may not be of the best interest. So it's made through court commitment. So we as the operators of that facility, we sometimes don't have a choice in who goes there. It's court mandated. So I'm sure everyone has heard of MDC. Any questions about MDC? Okay. Next question. Next section. What are support plans? If any of you have a child who has some specialized needs in school, and you've done an IEP, the support plans on our end are kind of the DD equivalent to an IEP. An IEP addresses specialized education needs for the child, and our support plans over here determine specialized service needs for both kids and adults. So it's not just school, but I mentioned that list of services that people can access. So the support plans are formal, written, documented plans of what the individual needs and what services may best meet the needs of the individual. And for kids, the family is involved in that too. What's going to best meet some of the needs of the family to stay together and be able to care for their disabled child. So,
Kelly, this is a question. What if the parent doesn't agree with the individual family support plan? They don't feel it meets their needs or their child's needs. What should they do?
This is a recommendation. This is not, I don't think there is anything mandated. I would first work with the case manager. For kids, the case manager is usually called an FSS. They may be called a case manager. For adults, the case manager may be called targeted case manager or just the case manager. If the parent cannot work through the disagreement with the case manager and they are really concerned, either the agency may have a formal process to go through if you disagree, or you may be able to contact your regional office and talk to someone there about concerns, that you have some real concerns with the plan meeting the support needs, and they may be able to intervene or assist in some collaboration negotiation. We have positions out in our regional offices. They're called Quality Improvement Specialists, and they are the state staff that do a lot of the monitoring of the programs and of providers and of case managers and how services are getting delivered. So they may be someone, if you don't feel comfortable, we of course prefer people to go through the provider chain first, start with who you have an issue with. But if there are reasons where that doesn't work out or you don't feel like you can go that route, you can call your regional office. Okay, any other questions real quick?
That's it for now.
Okay. The next section, it will get pulled up here in a second. What are waiver services, non-waiver services, and case management? Waiver services are what I was talking about earlier. We have different waivers. Each waiver has like a menu of services that you can choose from. And when I say choose, I mean your plan indicates that the child or the individual has some assessed needs. So what services in the menu are going to meet those assessed needs? Not all services are going to be appropriate or applicable based on that individual and what their needs are. So we have 3 waiver programs, and waiver is kind of a confusing term. But what a waiver is basically when you think of state plan, Medicaid, and you get all of these medical type services, PT, OT, doctor's appointments, a waiver is a list of services that is usually different than those medical model services. These are actually services where you're caring for people, you're teaching people, which is much different than I'm going to the doctor and they're looking at my arm and they're figuring out treatment that way. So a waiver is meant for those daily living and caregiving type supports, different than a medical model. So because state plan does not cover those types of services, they're covered through waivers and through some other programs. Waivers aren't the only thing that we offer. But you can see on the page there are 3 waivers listed, and I'm not going to go into details about what they are. If you want more information, you can contact your regional office. It does mention Part C services, which is a federal program. We get the federal dollars and we administer the program, we monitor it. Part C, infant and toddler early intervention. Most pediatricians and daycares know it as child find. Directly connected, we administer child find. And a lot of providers do a lot of hard work in following through with the requirements for that program. Family education and support is a different program that we also administer. It's not waiver, it's not Medicaid money, but it is it's not guaranteed that you will get those services. Part C is targeted birth to 36 months, and family education and support can be birth through age 22. There are different criteria to get FES than there are waiver. However, just because you may get or may have gotten one or both of these services does not mean that you're not entitled to waiver services or that you can't wait for the waiver services. So if you get one of them or both of them, it doesn't exclude you from getting waiver services in the future, because waiver services will cover you through either death or until you leave the waiver program. So it's still maybe in your best interest to at least be waiting for waiver services for long-term care. Okay, I talked a little bit about case management. If your child or your friend or family member or you are 16 or younger and you are getting waiver services, you get case management through the waiver. If you are 16 and younger, the only service that is entitled is Part C, which only goes to about age 3, 36 months. So the ages in between 3 and 16, there's nothing that's entitled that you will automatically get. If you are 16 and you're not getting other services, case management is entitled, and at 16 you are considered eligible for adult services and you are entitled to a case manager. And that is irrelevant on whether you are Medicaid eligible or not. So just keep that in mind, that at least that is one little type of support that you can get guaranteed at least at the age of 16 if you have been determined that you're eligible for our DD services. Any questions?
Yeah, well, not a question, just a comment. This was probably the hardest section to write because this actually covers every program through DD, and so everything is here on one page. It's kind of amazing that we were able to do that.
And this is Teresa. We did have one question come in.
Super.
To get waiver services, do you need to apply through the Office of Public Assistance or Mountain Pacific Quality Foundation or through DD program?
You need to get waiver services. There are criteria. So start with the DD program and they will tell you what other things you need to meet to be DD eligible. One thing is you need to meet the definition in the first place, so they'll give you guidance on how to do that. And at the time that you are put on the waiting list, I don't think you need to be receiving Medicaid at that particular time, but you will need to be receiving Medicaid if and when you do get into waiver services. So it's complicated and hard to explain, but Medicaid eligibility is one of our criteria to get waiver services, but you don't necessarily have to do that right now if you're not going to get services, for another several years. So I would just talk with the regional office and they will let you know what you need to do and where you need to go, where to start. Good questions. Thank you. Are we ready to move on with transition?
Yep, I already clicked it.
All right. This section, actually, Roger and the Pluck staff helped write more than I did. But one of the main feedback issues that we received is everyone talks about transition, transition, transition. What we realized as we were working through the guide is that there actually are several times where a person can be, quote, transitioning. So the most common one we think of is I'm transitioning out of school, I'm graduating, and I'm transitioning into adulthood. But there are other types of transitions that occur, especially when you are receiving DD services. So we talk about what some of these transition periods might be, and then when you should start asking questions and getting referred to other services, because transition just doesn't start happening at age 16, 17, or 18. There are transitions that occur that you may not think of when the child is earlier. And here it mentions transition from Part C, basically early intervention, into going to school. Start that. There's transition if you're receiving services from our autism waiver. It's a time-limited waiver. So there are transitions that occur when your time is done on that waiver. And, you need to plan ahead about, well, what happens when my time is up on the waiver and those services and supports go away. And then there is the most common, I'm transitioning into an adult. So we get a lot of we get a lot of questions about, I didn't know I was supposed to ask these questions so early. My child is turning 18 and they're graduating, and now what? And we don't have good answers for them because it's a process and it takes planning. And part of that planning may or may not include services through our program, because it's the only thing that we could offer is case management. So a lot of planning for other types of supports in the community. Okay. Any questions on that? The next section is...
This is Teresa. Sorry, yes, we did get one.
Okay, cool.
Should the schools be making sure to do a recent psychological evaluation, or does the DD program pay for that if there isn't a recent eval? How recent of an eval is needed?
Okay, I don't know how recent of an eval is needed. That may be individual to the person, and but I really don't know that answer. I do know that schools are only obligated to pay for psychological evals when they are trying to determine specialized needs as far as education goes. So I don't think that they are obligated to pay for and provide evals to just determine if they're eligible for developmental disability services. We do have evaluation and E&D clinics, we call them. It's evaluation and diagnosis, I think, is the formal term. But I'm not sure if there is an age limit on getting those, or if in some instances it may be up to the parents to pay for. I don't have a good answer for that.
It is a nice gesture by the schools to do that, even though they're not required to. Some schools do that.
Yep. You can ask. You can definitely ask them, and if they do, that's fantastic. But they're not obligated to if it's not related to an educational issue. So. Okay. If there's a specific question, I'm sure someone from the regional office could probably answer those more detailed issues than I could, so I apologize. All right, settling disagreements. We briefly touched on this. Basically, we prefer for you to solve any disagreements with your provider agencies or with the direct staff, but if that's not possible or if an agreement cannot be reached, you always have the right to contact your regional office. And I also want to read the last paragraph because we have gotten several comments over the years that some families are so grateful to just get any type of help. They're afraid of making their providers mad, and so they're afraid to speak up. And this last paragraph says, and not just families, individuals and services too. You ask questions, gather as much information as possible. You have the right to good services. The best way to get good services is to educate yourself and speak up. You cannot be forced out of services because you have a disagreement with DDP staff or a provider. Okay, very important. Just because you're asking questions and you're Diana Tavery and you're at the state office, just kidding, Diana, we love having you. Educate yourself. It's made a world of difference for Diana. We're here to help. People deserve good services. So don't be afraid to speak up. You can't be kicked out because you said, I don't quite like how things are going. Okay? Any questions or comments on that?
Nothing here.
Okay. The last section was actually written more by Roger and the Puck group. Very important. Roger, do you or someone else want to talk about some of the things in this section?
Yeah, well, actually, Diana and Teresa are going to talk about, a couple of these issues. And unless there's something else that you wanted to point out to folks, we'll start to move on to Diana and everybody to provide a little bit more input.
No, I don't have anything more to go through. However, if you still have more questions, get them into the questions or chat. And I mean, we're here to answer questions also if we can. So ask, and if I can't answer them, then at least you'll know where to go. So that's all.
Okay, Kelly, fabulous job, good work. I'm applauding you.
Yeah.
So next, we wanted to go to Diane Booth. Diane was one of the participants in the development of the guide, and Diane, just let me know when you're ready.
Can you hear me?
We can't hear you yet.
Roger, can you hear me now?
Oh yeah, that's better. You're a little
Okay.
faint. Just speak up.
Maybe I need to move it up to my face here a little more. Is that better?
No, you sound good. You sound good.
Okay. All right. I'm Diane Booth, and I'm a parent that helped with this guide, and I would like to emphasize what Kelly said at the last there, that we need to ask questions, and don't be afraid to ask questions. That was my problem going through this whole process with my son, is I just didn't ask questions I needed to ask sometimes. So, and what I want to say right now, too, is I'm going to read what's my part of the presentation, because otherwise I forget a lot of stuff, and I just want everybody to know that this is from a parent's perspective, and this all kind of happened to us after our son was diagnosed. So, okay, I'll start. I'm the mom, the proud mom of a pretty cool 17-year-old son with autism. I can't believe I have to start saying young man already. Time has flown by, even though when Logan was first diagnosed, I thought time had stopped and life would be over. But life did not stop, and we had to get on with it and start to figure out how to best help our son. Along this journey, we had to do a lot of learning in a whole different world than what we had been accustomed to. We had to learn the ropes of the medical community, the world of special education, including all the programs offered to children with autism. We also had to learn the system of services funded through the state and federal government, including Medicaid, SSI, and the services offered through the Developmental Disabilities program. We had no idea what an undertaking this was going to be in the years to come. It seemed everything and everybody descended upon us at once. We started making doctor's appointments to better understand what autism was, and even if that was what Logan had. We were having meetings at our house for reasons I did not understand with people I had never met, and discussing things that were not in my vocabulary. I pretended I understood everything they were talking about and hoped all this hoopla would end up helping my child, because that was all I wanted, was to help my child. After getting through the initial visits, evaluations, and filling out paperwork I didn't understand, I was very surprised to learn that there was so much financial support for children with special needs. Logan obtained Medicaid quite soon, for which we are forever grateful. I happened to go into the right office with the right person behind the desk that helped me get SSI and Medicaid for Logan at the same time. This financial support has kept our heads above water when it comes to Logan's medical concerns. The DDP and its services was another piece of confusion in trying to understand what role this program played in our lives. It seemed everyone wanted to help, but I just didn't understand what help they were trying to give. What did these people mean when they told me this is Logan's family support specialist, and she will help develop Logan's plan of care with goals and objectives? What is a family support specialist, and what is a plan of care with goals and objectives? I had never heard these terms before. At times it was quite overwhelming to adjust to the diagnosis and to handle all these new people with all these new plans in our lives all at once. For these reasons, I wanted to be part in the creation of this guide so parents of newly diagnosed children will have something they can read to explain what the DDP is. There needed to be something that would be helpful in getting information out to parents from the beginning of their child's diagnosis. This guide and its contents gives a very good overview of what services are offered through DDP and how to start the process obtaining these services for their child. Just last week, Roger gave me around 30 copies of the guide, and that afternoon I showed one to Logan's family support specialist. And I just want everybody to know I know who that person is now. We talked about the information in the guide and how I would like to have had the DDP services explained to me when Logan was diagnosed. She was excited about giving them out to her families. I had only brought in about 10 copies, thinking that would be enough for her to hand out. She asked if she could have the remainder that Roger had given me. I gladly went to my car to get them for her. All the FSSs at the Aware office in Billings will distribute the guide to their families. They were excited to have them and very willing to visit with the families about the information within the guide. This guide is just a piece of the information that parents need in the beginning stages of raising their child with special needs. There's also much to learn within the special education and medical communities. I think the sum of what we as parents need of we as parents need to learn is how to become our child's best advocate. It took me a long time to really understand what that meant. To me, that now means we as parents need to understand the importance in knowing how to write an effective plan of care, the importance in knowing how to write a productive IEP. Do not rely on the professionals to handle these and many other issues for us. I realize a child with special needs requires a team effort, but I want parents to always remember that they are their child's best advocate, and they always need to play an important part in this team effort. And ineffective plans can produce repercussions in later years for your child, and lack of progress is not a good thing. We always need to see progress in our kids. I do want to say it is a fact that my son has received an abundance of support through the years, both financially and through his plan of care within the DDP and its agencies. And at present, Logan is surrounded by caring people that only want the best for him and are striving to make his adult life as fulfilling as possible. We are so blessed with these wonderful people. It takes a lifetime of hard work and advocacy to raise a child with special needs. And if you think about it, it takes a lifetime of hard work and advocacy to raise a typically developing child. It just takes special tools for your special child. Parents need to be equipped with those tools. And then I'd like to just close and ask the question to anybody to give thoughts and consideration. Does anyone have any suggestions or thoughts on how to better equip parents of newly diagnosed children with the tools they need to be their child's best advocate? And that's what I have. That's from a parent's perspective.
That's fabulous, Diana. That's great. Good work.
Thank you.
You're welcome.
And if anybody has questions?
This is Teresa. So far all quiet, but anything comes up, Diana, I'll pass it your way.
Okay. Thank you.
Okay, we've got about, according to my calculation, about 10 minutes left. And we've got a couple more topics that we prepared. But I want to, in the time that's remaining, while we're going to talk about a couple more things, I would like all of the participants to think about what you've been presented in this guide and maybe what else needs to be, because this is our version 1 with we've made some updates to it, but if there's some areas that perhaps you have questions that aren't answered in this list, if you would please just input them online. They're not questions that we're going to have time to answer in the time that's remaining, but they're ones that we can consider as we continue to develop the guide. So any questions that you feel were not answered with the guide, or additional questions that you've got, please go ahead and enter them. And just another note, I put up the one page, the intro page here. The young man on the horse here is Diana's son, Logan, and I just wanted to point that out. So that's Logan. And I'm going to go to the back to the other considerations for families, and ask Diana Tavry to unmute and come on and talk to us a little bit about self-directed services. Diana?
I'm here. Can you hear me?
We can hear you.
Oh, great. Okay. I chose probably about a year and a half ago to port my money and take it to a self-direct payee, which is called Acumen, and they are based out of Salt Lake and Arizona. And they're essentially the middleman, and what they do is manage my cost plan for me, and my overhead is minimal in comparison to when I was working with a provider. Now, the only reason I was really able to go into self-direct was that the provider I was with did a phenomenal job to teach me how to be independent with my daughter. And so they spent many years training me how to design programs, how to, excuse me, I'm going to mute my phone. how to design programs, how to hire people effectively and train the people. And so I had owned several businesses of my own, and I felt, and I knew how to do payroll and workman's comp, unemployment, all of that stuff. So I was set up in a position where I was used to hundreds of employees, and I knew how to do that system. It's a very difficult system to navigate sometimes if you're green out of the chute. So I would recommend that if any parent is leaning in this direction, that you would get attached to somebody who's been in it for a while, that they could help mentor you through the process. There are some downsides to this program. One is that you have to be the one that does all the hiring. You have to do all the training. You have to do all the scheduling. You have to do all the payroll, minus the workman's comp and unemployment and taxes. They actually do that for you, the payee does. But you have to be the one that keeps the calculator hot and burning to make sure that you're not going over on your hours. And so every couple of weeks, I'm on that calculator calculating to the last dime how many hours I have a month and how much money I have. So it's almost like I have another bank account that I have to keep, great records on. And also, the state's going to soon be requiring information and data and things like that with your person. So you're going to have to also kind of have a little case management knowledge as to what kind of information the state's going to be asking from you as a parent. And we've already been keeping track of all of that. The nice part about going to the payee is that your entire budget, all for the exception, I think, of for us, it's maybe $600 a year, is all directed towards services for my daughter. Now, that is not something that I would have been interested in when Mackenzie was in school, because I had plenty of cost plan to cover and to be with a provider. When she graduated from high school, it was a different story. I had another 6, 7, 8 hours to fill during the day, and that's when I had to make that difficult choice of going to self-direct. I really highly recommend that people who have young children stay with their providers. I think that without their knowledge and their leadership and their expertise and their training, you'd never get to a place where you could do self-direct by yourself. And that's the only reason why I'm doing it at this point. I had phenomenal case management and caseworkers, and I give them all the credit of what I know and how I can do things for my daughter to the provider. So it's not designed for everybody, but it's a good segue to get my daughter to a place that someday she'll be able to hopefully manage her own cost plan with very little input on my part, which sort of leads me into the guardianship piece that Teresa's going to talk about. We are co-guardians together in her life. It's limited guardianship, and so, she has a lot to say about who works for her and who she likes and who she doesn't like. And so other areas you have to remember is you need to know labor laws with self-directing, understand how you correctly hire people and fire people, and I've had to fire a few people. So it's an information gathering time with self-direct.
Okay.
You can give them to Teresa, who's going to be up next, I think.
Okay, thanks, Di. And Teresa, you got 2 minutes to talk about guardianship and alternatives.
2 minutes, got it. Okay. Basically, if you want more information, go to our website, because it is the last link on our homepage under links, a project called Alternatives to Guardianship, because I want people to realize that guardianship is not the only option. It may be an important option for some people, and it may be the wrong option for people. I kind of tend to look at this in the perspective of least restrictive, similar to what we do in school, where a least restrictive options could be increased support from the family, such as Diana's doing, representative payees, someone who helps with the checking, someone who helps with medication. You can go to kind of a middle ground where there is limited or temporary guardianship in regard to residence or medical. Special needs trusts come into that middle ground, and look at the most restrictive option being that full guardianship. for families, a lot of times this doesn't surface as an issue or a concern until we're at that IEP and the transfer of rights occurs. And during that, all of a sudden parents, the lights go on and say, what do you mean that hopefully in a year, and sometimes this meeting's occurring just a couple months ahead of time, my child will now be signing this IEP. What else will they be taking charge of? So it is a planning and preparing process. It is an ongoing training. When we started looking at this for our individual family and for my son, training for that began a long time ago. And when we look back, I don't even realize how long ago. But we made it a mental shift to, as an adult, how would you handle this situation? As an adult, what tools would you need to help you handle this situation? How's that for 2 minutes?
That's fabulous. Okay, guys, you did a fabulous job. I don't see any questions coming in. Did you have anything come directly to you, Teresa? Otherwise,
I didn't.
We will call it a webinar.
I just want to, this is Kelly, and I just want to add one more thing that the guide doesn't really touch on too much, and that is the autism insurance bill. What that is you don't have to be getting any DD services. You don't have to meet our DD eligibility criteria. You meet insurance eligibility criteria. But in effective January of 2010, most insurance companies, and I say most because not all of them are required, most insurance companies are required to cover services and medical services for children with autism spectrum disorder. I think insurance companies have autonomy to decide what that criteria is, but again, I highly recommend if you're waiting for DD services and you and your family member, child, friend are suspected to have autism spectrum, check it out with your insurance companies, because you may be able to get a lot of help from your insurance company now, specifically for autism-related medical and other services. So check it out.
And Roger, I just have a couple closing remarks before you send everyone away. Did you have any last things you wanted to say?
I was going to ask you.
Okay, all right. I just wanted to remind everyone that we will be sending you an email with a link to a really short evaluation of today's webinar, and we beg and plead you to go to that, follow that link, and fill out the evaluation for us. We really appreciate that. And then our next webinar will be on July 19th from 1 until 2:30 Mountain Daylight Time, and it will be parent-to-parent critical skills for your child to develop. And the flyer should be going out in the next couple of weeks to listserv members, and we'll also have registration information posted on our website. And in your chat box now you should see the Rural Institute Transition Projects website and the PLUC Transition Online Toolbox website. And both of those are where the audio recording of today's session will be posted. So if you have other folks who you think would benefit from listening to today's webinar and watching the guide as Roger and the other presenters went through it, refer them to one of those two websites, and it takes usually a couple of weeks to get it up. Wanted to thank all of the audience members today for your participation, and especially thanks to our fabulous presenters. You folks did a wonderful job. I know I've learned a ton, and hopefully our audience members have as well. Anything else from anybody?
Thanks for organizing it, Kim.
You bet.
Nothing coming in our question box.
Okay, I'm stopped showing my screen.
All right. Well, thank you, everyone. Have a great afternoon.
Thanks, everybody.
Okay. Thank you. Bye-bye.
Bye.